Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Lassiter,
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today, we're going to be doing the very first video. We're going to be doing the very first video in our menopause series, defining what it is, what it looks like, and how we can go about treating some of the symptoms.
Yeah, so let's talk about what it is.
So menopause technically is defined as going 12 months without a menstrual period, right?
So 12 months without bleeding.
Well, I should also give a caveat that you're not pregnant.
Yes, yeah.
Because you could go 12 months without a menstrual period because you're pregnant and then in the immediate postpartum period, and that's not menopause.
True. Okay, valid. So we're talking about later on in life, usually typically around the age of 50, 51 in the United States, people will go through menopause. So again, 12 months of not having a period.
Right. And there's kind of this perimenopause, like peri means around. So around menopause that could start up to 5 or 10 years before where you start having some symptoms.
When we talk about perimenopause versus menopause, we're really talking about perimenopause being the time around those first 12 months where you don't have a period at all.
Because what can happen for some people is, well, I guess maybe physiologically explaining that a period happens when you release an egg and then it is not fertilized and then you shed the uterine lining. And that happens because of a big rise in hormones and drop in hormones. So what can happen is people might be having extended periods of time between their periods. So they might skip one month or maybe 2 months between. So you have to go a full 12 months with no bleeding or period symptoms for it to qualify as actually being in menopause. And if you have another one, you got to start over.
That's right. Yeah. So there are some rare cases where people will go the full 12 months and then have another period. And so then you got to start over of when you're actually in menopause.
Right. So that would be in that same stage of perimenopause, around menopause.
Right. So usually the symptoms of perimenopause, which we'll be talking about in our next video, start off pretty mild and maybe not even that noticeable, but then they peak around a year to 2 years after you've had your very last menstrual period ever.
So, okay, next video is going to be all the signs and symptoms that you can expect. And then the video after that is how we're kind of going about treating.
Yeah, so stay tuned.
Please like, comment, subscribe. We'll see you soon.
Bye.